go back to nature, go back to the earth, and stimulate our own body to create health.
Who are you, and what is your general belief on health?
There is a ultimate healing capacity within every patient. If you don't have your health, what do you have?
You are a functional medicine doctor.
Join us as we blend modern and ancient wisdoms to be well now.
It feels like in my world, synthetic versus natural is a big battle, and regenerative health, I think, is an interesting tapestry upon which we can kind of explore the topic.
Absolutely. Well, there is a synthetic medicine, right, that we're dealing with a lot now. Chemical medicine, medicine created in a lab. And there also is this movement or this push, it seems recently, to go back to nature, go back to the earth, and recognize what it has given us and how we can take advantage of what it's given us to actually perpetuate health and stimulate our own body to create health in perpetuity.
In perpetuity, that's a fancy word. Mm-hmm. We're not all fancy words here in the Be Well Now podcast.
Just keep it going.
I'm Nick from Community Health and Wellness, and I don't even work here, but I'm in the building. You're Ron.
I'm Dr. Dummar with Community Health and Wellness, and I do work here, actually.
You do work. I feel like I work here sometimes, yeah.
Yes.
No, but the podcast started a couple years ago. I, as your patient, asking you a bunch of questions, suggested the podcast because I'm real fired up. I see the way you heal patients here. And I guess I wondered, who are you, and what is your general belief on health?
Yeah, and I think that this is really what it comes down to. We wanted to have a get back to your roots day. Is that what this is now?
I think so.
You're asking me what is it we're up to and what are we doing here really?
Well, I guess, whether it's traditional or because I feel like you're alternative medicine these days, but really you're the traditional medicine.
Yes. And I love that you said that because alternative, suggesting that
health.
I'm the alternative, that is so contrarian to what I do, right? If what does tradition mean? Tradition means it's something that's been passed down, carried on, something that you've learned from your ancestors or learned from your parents, right? That's tradition, right? I mean, if anything, the current modus of health that we have is the antithesis of tradition, right? They often refer to certain treatments that we do in a traditional way as arcane, right, and outdated.
What do you mean?
Like old, ancient,
but
arcane.
Who's they and what are you talking about?
So Western medicine, right? They'll often refer to some of these practices. Even 10 years ago, acupuncture. 15 years ago, acupuncture, gua sha, cupping, a variety of these different techniques were really looked at as, that's why are you even doing that?
Gua sha is like a kind of a scraping massage.
It's a scraping massage to kind of break up and smooth out the fascia adhesions.
Even though I feel like physical therapists have been doing scraping, and I mean, it's so
They've
interesting.
They've been doing modes of that. Yeah, different.
Labeling it as odd is fascinating to me because I've watched it in your practice and I've watched it work for me, and obviously you have a lot of patients who very busy clinic for a reason, I think.
Yeah, so the idea really is that I'm a proponent of medicine that works as naturally for the patient. Our objective really is to stimulate something within the patient. There is a ultimate healing capacity within every patient, right? They are the ultimate healer. You are the ultimate healer.
Yeah, but how does that work?
So all we want to do is turn that switch on. Whether that has, some people look at almost in a biblical sense, like if you believe, it can happen. So yeah, if you can turn a belief switch on, if you can activate something within the cellular framework that affects the DNA or affects the mitochondria and improves the function and energy of the cells, that can turn a switch too, right? So there's a variety of different ways to go about this. But there are some differences in the approach between, even though I say we want to address everything or be able to include everything, be inclusionary in our approach. I don't like to exclude things from the table. I'm not saying we're never going to include or utilize synthetic medicine. However, my approach is to always lean first on those things that are as natural as possible, or those things that are going to first stimulate the body's innate healing capacity to accomplish the healing work. That's our first objective. That, in a sense, we could say is regenerative medicine. You're trying to initiate the ability of the body or stimulate its potential from within itself to actually regenerate, right? You know, if you lose a portion of your liver, you can actually regrow liver cells. Your body, it's like the lizard tail of the body, right? So that's a regenerative process. It actually regenerates. And our body does have a way of regenerating its cells as well. So if I get a cut, if you got a cut when you were a kid, did you look at that and you're like, oh gosh, what sort of synthetic medication should I put on this? Or what should I rub on this? Or what should I do? Usually you just kind of brush it off and you keep playing. And you wake up the next day and you're like, wow, that looks a lot better. So your body instinctively, intuitively began the process of regenerating that skin, the skin cell, to heal it. So that many cuts or many wounds that we experience, we don't even remember. We don't remember because we've already moved past that and regenerated that. So regenerative medicine is really stimulating the body's ability or capacity to heal itself.
So when you mention regenerative medicine, it's like a hot topic now with older folks who may be spending a lot of money, or I say older folks, not children.
I think regenerative medicine is a really popular topic with people in general now that are interested in...
Like, what is it?
Interested in essentially a natural way or a more natural way, or something that seems to be more amenable to the body as opposed to overwhelming the body with a medication. Like you put in a drug or you use a synthetic, it's designed to attach to a specific receptor site and to basically insert itself. Plants don't work that way. Regenerative medicine doesn't work that way. Regenerative medicine works by introducing a substance that stimulates something within the body to begin a process that is naturally occurring within the body, or maybe it needs to be spurned on or stimulated, right? So that the process within the body that occurs naturally begins to occur at a higher rate.
Are we talking about like stem cells? I'm just looking for examples of what is it. And
Yes. Yeah. So stem cells, platelet-rich protein, that's where people often go to first. Platelet-rich plasma. So PRP, stem cells. But one of the forms of regenerative medicine that we've been using for a long time is acupuncture. Acupuncture is regenerative medicine. And the reason it's regenerative medicine is because, again, it stimulates something within the body to initiate a response that is natural by the body to balance and create harmony and health, right? Without introducing any basically outside or synthetic substance. So when we use acupuncture, we stimulate nerves. Those nerve signals are sent to the brain, and then we increase blood flow and circulation to different parts of the brain through that nerve stimulation. And then that excitation elicits a response in an organ. So it could improve liver function. It could improve hormone regulation. It could improve kidney function. We do it a lot to improve digestion, to reduce anxiety and stress. So cortisol release in the body, and also the balance of the autonomic nervous system. So when we use acupuncture as, I would say, one of the most ancient regenerative medicines that we have, we're practicing regenerative medicine at its core.
Okay. I mean, that makes sense to me. I hadn't been to acupuncture in like a month, and I did it the other day, and I was like, oh, this is nice. It just felt like it really gave my body like this nourishing, resting, not even a reset. It just kind of like everything felt connected and like ready to go.
Yeah.
For the rest of the day.
So think about this. I have patients who come in and they're like, wow, man, my knees, my shoulders, I'm really hurting. And, they've been going for a while. And then they tell me, you know what? I had a great experience with stem cells. I had a great experience. I got stem cells injections. Boy, those things really work. Okay, well, stem cells, that's fine. Stem cells are great. And they should work because stem cells are designed to differentiate or essentially to morph into whatever tissue they need to be. Just like when you have a cut on your hand and then you start to see eventually that tissue forms over, right? There's a little scab on there and then it becomes skin again. You literally need stem cells there to regenerate that tissue so it looks like what you were before. So stem cells do that. So if you put that, let's say you have a ligament injury or you have a tendon injury or you have, maybe you're developing some bone to bone or you're wearing out your meniscus in your knee, they insert those stem cells, and the hope is that you can have this regenerative effect to create, at least to slow the progression of that degeneration, if not to actually maybe even recreate or regenerate some of what was lost. Okay? So acupuncture actually has that capacity as well. And so do herbs. So patients will say to me, oh my gosh, I believe in this stem cell work. It's so great. Well, that's fantastic. Stem cells do a great job and a great work. But stem cells are like, it's like so far down the line. There's so much you can go upstream and say, how do I support my body from a whole health regenerative medicine process, right? Not just jumping all of a sudden to stem cells.
Stem cells are expensive, right?
Yeah, usually you're talking about $7,000 to get stem cell injections, somewhere around there. You can also get platelet-rich plasma injections, which we do here in the office. So platelet-rich plasma injections are essentially stem cells. So stem cells, essentially they differentiate. So platelets will also differentiate. When we inject platelets into the body, they're surrounded by an area that has been damaged or injured and needs some reparative mechanism to take place, right?
When would you use them?
So if somebody has had a tear or chronic injury, even if they've had chronic tendinosis, inflammation in the knees, the shoulders, the elbows, the neck, the spine, we can use it in and around any of the joints, the tendons, the ligaments. So if you've had some sort of tendon, ligament, joint injury, we can definitely use it.
Is it good for arthritis?
Yes, it can be beneficial for arthritis.
What do you recommend for arthritis if you worked on something and they're like, yeah, it's an orthopedic issue, it's not a tendon issue?
Yeah, so arthritis, it depends on the type of arthritis and how progressed it is. So arthritis, arthro is joint, itis is inflammation. So that's what you have to realize first of all. The only thing that you're literally saying in medical speak when you say arthritis is there's inflammation in my joint. And it's almost like you going in and telling the doctor that your knee is inflamed and swollen and it hurts, and he turns around and says to you, your knee is inflamed and swollen and it hurts. But he says it in the form of arthritis.
Yeah.
And you go, ah.
Why do we love the title so much?
Oh my gosh, I don't know. I think people, it's a solution in their mind. They
wear it like a badge.
They feel like, oh my gosh, this guy knows. I have something that everybody else has. It's almost like validity for people. I'm not the oddball, but there are some people, and this is a totally different rabbit hole, but sometimes there are some people who they prefer to be the mystery, right? Like they would prefer to be the one that nobody can solve. And that's an interesting situation as well. We're not really here to talk about that today. We can talk about that on maybe another episode, but that is another condition that people can get themselves into. But really what we're focused on is today, regenerative medicine and how we help people to harness what they have within them, which is the healing capacity for everything. Anything that is damaged, injured, torn, needs repair within the body, you have the capacity within you to heal that. And the question is, what are you missing? Is there a deficiency? Is there an excess? So an excess might be like an infection, right? A deficiency might be like a nutrient, like a vitamin, a mineral, something that you're missing, that you're not getting enough, that if you got just a little bit more of, all of a sudden the body could be like, oh, okay.
Like way downstream from what's actually happening. Can you give me an example of what nutrient or something up or downstream would then affect my knee or my liver or whatever it is that I'm coming into you with an issue about.
Well, a very classic one that we use in medical textbooks a lot actually is scurvy, which is basically it's a disorder of the mouth, teeth, and gums, and people would actually die from scurvy. A lot of sailors would be on ships and they didn't have access to this citrus type of fruit. And they didn't even realize what it was or what it was caused from, this scurvy condition, where they would lose lots of sailors. And then eventually they realized that there were certain sailors or ships that would carry these citrus fruits. And the ones that did had no issues with scurvy. And so they began to study that. And they realized that it was actually vitamin C. So the deficiency of vitamin C for a patient led to this kind of bleeding disorder, or this mouth, teeth, gum disorder, where patients actually died as a result of the deficiency of vitamin C. Interesting thing is there's a difference between us and animals, the mammalian world. Mammals actually can make vitamin C. So they make it in response to stress. So we have these stress hormones in our body. We have stress hormones as well. So if you have increased stress hormones, animals also will have a mechanism where they make vitamin C, and that helps them to actually mitigate and regulate those stress hormones. How much do you know is happening or occurring with anxiety nowadays, with depression, with mental health disorders? And so much of that is a nutrient deficiency. One of those nutrients, very possibly vitamin C, that people are deficient in.
It is interesting because I mentioned when I travel that sometimes I get sick, and you said, whenever you're feeling really tired and you're reaching for that cup of coffee, because I flirt with not drinking coffee, and then maybe if I travel for work, I'll just fall off the wagon again, or whatever the saying is. You're like, when you're really feeling like you're about to reach for the caffeine, and I still do it anyway, if I need it, especially if I'm traveling, you're like, make sure to dose vitamin C.
Yeah.
And so whenever I'm stressed or tired, I always remind myself, I'm like, maybe I should. So I just bought those NRC packets from
Good. Yeah.
Natural grocers with all kinds of citric acid and probably all kinds of other ingredients. But I feel like maybe it's psychological, but like if I get a packet or two of that in some water and drink it, I'm like, I just feel better. I'm like, I'm going to be able to handle whatever is coming up.
Yeah, it's like, and those packets are super interesting, right? It's like giving your body a swath of stuff, right?
Yeah.
There are a lot of ingredients in there. And really what you're doing is like, let's throw something at the wall, and hopefully I pass enough stuff through my GI that my body's like, oh, hey, we actually need that right now. Oh, we could need that. And it's like, no, we don't need those things. Right. And that's literally what we are. We're like this open hole donut, and we're passing all this stuff through, and our body is testing and determining, hey, what do I need? What do I need? Well, it's our body that determines what to take in and what to pass through, right? So there's an intelligence within us. That's what I'm saying. It's like there's an intelligence within us that says, hey, I realize you just ate all this stuff, but these are the products or compounds that we're actually going to take into our body because we need them right now. And all those other things we're just going to discard. And that's literally what we do all day long. So given that idea, how important do you think it is for us to be passing things through that would be more beneficial to the body, right? Or what do you think that we would be, we look at our food supply. RFK Jr., here's another shout out for RFK Jr. going through his confirmation hearings and everything right now. It's looking like he's going to get approved. In the light of all of that, the FDA just came out too, and they decided to side with RFK Jr., who's been excoriated for years for suggesting that red food dye is a cause of cancer.
You know that everyone's talking about red food dye right now?
Well, that's because that's just what happened. The FDA came out and admitted it. They're like, yes, it's causing cancer. So we're pulling it out, and they're phasing it out of all of our food. So here's number one best thing that's ever happened in the entire, past 50 years in our food industry is that RFK Jr. starts going through his confirmation hearing, and the FDA goes, oh crap, we better start really, cleaning things up. And then boom, we get the admission, oh yeah, this red food dye that he's been talking about for 15 years as the cause of cancer, and we've been excoriating him and calling him a fringe. individual and a conspiracy theorist, we do have evidence it causes cancer. Okay, so we're about to have thousands more things like that take place where we're going to be cleaning up our food supply. So my point is, do we want all these like Fruit Loops and colored weird cereals and sugary garbage, right? That literally is just some product that was made synthetically in a manufacturing plant somewhere. Is that what we want to be feeding our kids? Is that what we want to be directing their intelligent design? So that their body's like, gosh, I haven't gotten a decent meal in days, right? Because we're just eating all this garbage food. And what are all these extra ingredients that I don't even recognize? This is what your body's doing. Like who created this? This is not God's creation, right? This doesn't come from the world that I came from. Like we're literally going to return to the dust, right? Of this earth. We become this earth. Right? And we're taken up when we're here, we are of this earth. And so what we need to do is put what is in our body that is of this earth. And our body will recognize those compounds because it came from that, right? And it recognizes it in a way that it's able to distinguish what it needs to get rid of and what it needs to keep. But when we start throwing in synthetic compounds, it doesn't know what to do with them.
You talk about like even local honey.
Oh, 100%.
You know, and how, because it's from our local environment, we can gain a lot of wisdom from taking some of that in. And you have your explanation of that. But I even look at that, like going for a walk in nature, I'll look at some of these trees. Like I saw this, I was walking yesterday and all the trees are barren. And this one tree was, and every other tree had all the orange and yellow leaves on the ground and the branches were barren. And this one tree was still like this vibrant orange with all the leaves still on there. And I just went up and I like touched the tree and I'm like, what can I learn from you?
Yeah.
You're different than all the rest. You know what I mean? And it's like just getting in touch with the environment around us. It might sound weird to a previous version of myself, but it all seems like it's making more sense now. It's like we come from this earth. I feel like we've lost our connection to nature and what grows from the ground. And it's not going to be long before we're there, like you said. So there's just got to be a lot of wisdom from something that can like withstand all of the elements and is still here. I'm really into trees lately. I'm really enjoying walks through nature, but that's my little rant.
Well, there's an idealistic understanding that we all have, and I think it permeates our cultures in a variety of ways, and that is this idea of being one, like being unified, synergism, that we can accomplish more together if we are unified, if we can become one, if we can get in sync and in line. Why would anyone aim to be out or incongruent with the design of their own body? And this is what happens. People become incongruent. They're disconnected from nature. They're disconnected from their own feelings. They're disconnected from this world. They want to dissociate. And what we need to do is be here, be aware, and understand what's happening around you so that you can fully embody what's happening and be a true actor. Be a true actor in and around your environment. And so when you choose to put food, and we've talked about this principle before, when you choose to put something into your mouth, you're an actor engaged in your own experience, creating your own health for perpetuity, for the future, right? And the question is, what is your creation? What do you choose for your creation? Because you're doing this as your creation every day.
Yeah, people talk about creation and art, and I'm like, life is creation and art. Everything we do is, the tapestry of our life.
Yes. And so what better way for us to say, today, let's look at it today. What do I choose? What do I choose? Do I have an instinctual or innate understanding, inherent understanding of medicine? Like, what is medicine? Where should medicine come from? Where should I be looking for my health from? Like, what should be healing my body? Well, number one, instinctively and intuitively, if we start to really tap in, we begin to realize there's something pretty incredible about me. There's something pretty impressive about me, actually, that I do have this capacity to heal. I do have this capacity to regenerate. I do have this capacity to sustain a healthy life.
If you even have a doubt, because life is really hard, and like a lot of people are not on this spiritual journey, and they're just trying to like feel better today, and they're unhealthy. It's like, but just the fact that your heart beats while you sleep, that you don't have to do anything, and it still beats for you. You know, it's like you didn't make it beat; it's like just the fact that it beats overnight while you sleep is so miraculous to me. Just the fact, I'm almost 40. I'm like a vintage vehicle, you know, and it's like, how is this still? This really is miraculous.
Yes.
I mean, look at a car try to run it for 40 years with like, it's just, I think eventually you realize there's something miraculous about this life.
Well, I'm going to push back just a little bit on that because awareness is what we're talking about and stepping in, right? We do have a impact on the beating of our heart. We do have an impact on the regulation of our autonomic nervous system. Autonomic nervous system regulates heart rhythm, okay? So autonomic nervous system, if there's a dysfunction in it, it's the stress, right? The fight or flight and the rest and digest system of the body. There's an enteric nervous system as well. So the enteric nervous system, which is the gut and the GI, the gut brain, it interacts with the autonomic nervous system. So fight or flight, rest and digest. Are we balanced or are we in a state of fear and fright? Right? We can impact that if we can do meditation, if we can participate in yoga, if we can do tapping, if we can do breath work, we can do, there's a whole host of exercises that we can participate in that will actually influence the way our heart beats. Okay? We do have a capacity. It's in us. We're beating our heart. On some level, you created this body, right? You created this body. The neurology at first was initiated, right? And you sent the signals somehow. We talked about this on a previous podcast as well, but it's like, look at the embryology. As you develop as a cluster of nerves, essentially, the forebrain, the midbrain, the hindbrain, the spinal cord, and then really you're just having these extensions that take place, these neurological extensions. It's all nerves. It's all nerves, and all that's being sent through there are intelligent signals that feel like or maybe look like to us electrical impulses. And somehow through that intelligent electrical impulse, it gives the information to create a hepatic cell, which is a liver cell, right? Or a renal cell, which is a kidney cell, or a pancreatic cell. And all of a sudden we have these organs that develop. We build our own heart, 4 chambers of a heart. The intelligence somehow. And this brings up another thing, because sometimes people look at intelligence and understanding and awareness as being a brain activity, right? But you can actually direct your brain to perform certain functions, to focus more, to learn more, to understand or to memorize something. Like you're directing your brain to do that, which means you actually have an influence over your electrical impulses throughout your life, right? So then the question is, if I have an influence over the electrical impulses that actually created this whole being, every organ of this being that pumps the heart, that sends the electrical contractions down through the fibers of the heart and initiates those contractions, right? If I have an influence over that, how can I impact it now? And the way we impact it is by giving it the intelligence, directing the intelligence to create the experience that we want to have moving forward in the future, right? So these are things that we've talked about, like scripting. We like to do a lot of scripting in the office too, but goal setting, people can accomplish these things with goal setting. They can do it with breath work, with meditation, with yoga. But these are all things where you can become more aware and harness the innate healing capacity that's within you. And then you begin to make true choices. Okay, now, do I want to use stem cells? Do I want to use platelet-rich plasma? Do I want to use herbs? Or do I want to use a synthetic medication? And you know what? None of those choices are wrong. None of them are wrong when you come from the ownership of the innate, understanding and the healing capacity within you, you make a choice. And you say, okay, I'm going to use this one.
But how do you convince someone who's in a lot of pain and discomfort and dis-ease that their body is this wonderful, God-created vessel that can heal itself and has all the ability already to heal itself when they are feeling so broken and so dejected, and they have a lot of history and experiences to prove it that it doesn't work? Like in their head,
that they're dysfunctional.
They believe that their body will betray them. They're broken.
But that very fact that they believe they're broken suggests that there is some corrective modality or process, right? You can't acknowledge the fact that you're broken, right, without acknowledging the fact that there's some way of being not broken. How do you do that?
What if it all happened to you? What if it all happened to you and it's all your parents?
Well, that's fine.
And everything?
It's fine, but there's still a corrective mechanism.
Okay.
Like it happened to you. You had a broken experience. You chose to propagate this broken life, and that's okay, right? And you didn't have at some point the awareness or the intelligent understanding to be able to process some of these things you experienced, right? You weren't as intelligent with your ability or aware of your ability to be a creator and to impact your experience. And so as a result, the way that you reacted when you were a child was your creation. Like you're still a creator. You're a creator your entire life. Just half the time we're creating unconsciously. And so when we're unconsciously creating and we're not aware of our creative ability and our creative capacity, we make choices and decisions that oftentimes are against our best benefit. And so we enter into and engage in relationships, or we consume foods that give us temporary pleasure or temporary respite from the suffering of our life, but do nothing for the perpetual propagation of health. And what we want to do is say to individuals, yes, we understand there is suffering. Yes, we understand there is heartache, there is sorrow, there is pain, and it is deep, and it is horrible. And let us say, we understand you. We get you. We embrace you, and we love you. And that's the point. You all have the capacity. We all have the capacity to come together, to embrace our internal healing instincts, our innate capacity, just like when we get a cut to heal. We can heal anything there is that we're suffering from. We can address that. Now, will it be frustrating? Is it going to be an easy road? Not necessarily. I doubt that it's going to be an easy road, but you will learn as you embrace your capacity and acknowledge your capacity to heal. And you will learn that it's a way more exciting, a way more thrilling, and a way more adventurous process and journey than the latter.
I've been reflecting on how things happen, just not on our timeline. And if I could really look back on whatever goals I created and certain things I wanted to happen, it's like, okay, a lot of things that I didn't want to happen happened.
Yes.
And a lot of pain along the way. But a lot of really beautiful things that I would have once wanted, and they just didn't happen right away or when I thought they would. So I maybe just, and it's like, wow, if I could just see that it's all happening, just not on the timeline that I chose.
Mm-hmm.
So that maybe the healing process is going to be very difficult, but it's happening. It might take you 6 years instead of 6 months.
Yeah.
Is that a crazy thing to say? But like, the journey is the destination, so we're here for it. I don't know.
Yeah, well, so again, that's a really good point though, Nick, too, because what we're asking people to do, what I'm asking people to do, what you're making the allusion to and asking people to do is to buy in to their own creative capacity and to choose to be a being of healing. That's it. That's all we're choosing. That's all we're asking you to do. Choose to be a being of healing rather than a being of dysfunction and destruction. That's it.
Internally and externally.
Yes, internally, externally, your whole life. And then as soon as you make those choices, this is the cool thing about it. As soon as you make that choice, like you make the conscious choice, okay, I'm actually going to choose healing now in my life. I'm going to choose this road. It's not an easy road. And it doesn't mean that you'll never get sick. And it doesn't mean that you'll never have dysfunction in your body. But what it means is that you choose to embrace the healing capacity that you have and make your decisions from this awareness within yourself of how am I stimulating the regenerative capacity or supporting the regenerative capacity that I have personally within me, that I know can do anything, can heal anything, that can resolve any wound and resolve any suffering soul, right? That's what we have the capacity to do.
So did we kind of fully flesh out then the regenerative, very expensive PRP and stem cells versus kind of your overall systems approach?
Yeah. So
I just want to kind of like bookend. A good story has a bookend, right? Let's bookend this with any final thoughts on kind of how you help promote all the other things before we try the stem cells.
Really what we're talking about again is the difference between systems biology and reductive medicine. Right? Reductive medicine is trying to say, okay, here's a symptom, here's a fix. Here's a symptom, here's a fix. Reductive medicine, we're looking at it that way. Systems biology is more like, okay, we understand that there's, you look at an ecological system, there's water, there's trees, there's soil, there's bacteria, there's sunlight, and all of these factors that go into the health, right? And the health promotion of that space. And how do we support that space as much as possible? And how do we limit any sort of chemical toxicity that we're introducing that could basically kill off that entire species, the entire ecology, could be destroyed at some point by an introduction of, red food dye, right? So how do we limit as much as possible these things that are going to potentially cause very poor effects down the road and maximize as much as possible those things that are going to stimulate our own healing capacity, regenerative capacity within us. So yes, stem cells is not a bad, it's not a bad place, but the place to start is nutrition. It's your food. It's your nutrients, it's your minerals, it's your vitamins. You should be looking at all of those things for your overall health. And then we can start talking about, okay, could PRP be beneficial for you? Or could stem cells be beneficial for you? Because your body is going to receive those stem cells if it's supported already by those former things, the nutrition and the vitamins, minerals. Your body's going to receive the stem cells, it's going to receive this PRP and be able to do way more with it than it otherwise would if you're not in that healthy state.
I think it's a good way to end the podcast. If they have any questions, how can they reach out?
Oh, you can find us at chwheber.com.
Just rolls off the tongue.
Yeah, it's just right there. I do not have to pause and think about it anymore, so that's good. Or call us at the office. We have great staff, great
What's
crew.
the phone number?
435-657-3696.
You sounded kind of like a like a shopping channel.
Okay.
In the next hour.
If you can get this right now, you can buy this. And if you purchase right now, you'll be able to get this special deal, this special offer. So call right now, 435-657-3696. Was that good?
To unlock your health today. Be well now, everybody.
Be well now. Namaste.
Namaste.